welcome back everybody to another episode of Project Transitions podcast, Transition Points. I'm here with our National Clinical Director, Dr. Julie Gersch. Good morning, Dr. Gersch.
Good morning, Brandon.
How we doing today?
Awesome.
Just for circumstances, it is currently 8:05 in the morning, and they're about to do a leadership all-day meeting. So Dr. Gersch was very, very nice of Dr. Trevor to sit down with me this early in the morning, so I appreciate you.
No worries.
And you flew in from Tennessee this week, right?
Correct.
And you're just up here for like a leadership summit kind of thing?
Yes, we've had several leadership meetings and visits to programs, so getting a lot of great work done.
What was your flight like? Was it good, or was it very bumpy along the way?
It was mostly calm. We had one big pocket of pretty significant turbulence that the pilot came on and explained was due to the excessive heat hitting the east side of our country. So that was interesting. I've never been told that by a pilot before.
Yeah, that's crazy. We're like in a heat dome right now, I think they call it,
Yes.
and it's just not a good time. I'm not thriving. So you've been with our company for about 10 months now?
7 months.
7 months, okay.
To today. 7 months to today.
Congratulations. Happy 7-month anniversary.
Thank you. Project Transition has been such a neat experience and some happy accidents almost sort of along the way, and that I've been able to learn and discover things I could have never known until I really got here. So lots and lots to be proud of and impressed by this company, its long, rich history, and quite frankly, just the team that's here now.
Yeah. 40 years we've been here, and I think like we're doing amazing right now. So let's take a step back. So you've been in this field for a while now. But I want to know, like, where did your aspirations to become a psychologist start? Like, where did you go to school? All that kind of stuff.
Yeah. So I knew pretty early on, I would say in middle school, that I wanted to be what I thought was a psychologist. I had been reinforced by peers of kind of being a good listener and a helper and caring and all of those, kind of baseline qualifications of a person wanting to go into the field. But interestingly, in the 80s, there was a show called Growing Pains.
With Alan Thicke, right?
Yes, you got it. And I would watch that show after school in the afternoons as a middle schooler, and I wanted to be the dad on that. I forget the name now, Dr. whatever he was.
Dr. Seaver.
Seaver, yes.
I used to watch the reruns on Disney Channel.
Look at you.
Yeah.
I love it. So Dr. Seaver, I thought, had the perfect life. He got to work from home and help people, and he seemed like just a cool guy. So that is kind of what I hitched my aspirations to. Although I was so young, I didn't understand at that point the difference between a psychiatrist, which was Dr. Seaver, and a psychologist, but it still worked out.
Do you think you can elaborate quickly for our listeners that don't know what the difference between a psychiatrist and a psychologist is?
Absolutely. So psychiatrist, first and foremost, goes to medical school. So they are physicians, and they spend their academic time after college, after getting an undergraduate degree, going to a medical school, either an MD or DO kind of school. Psychologists also get a bachelor's degree, typically in psychology. It doesn't have to be. And then we go on to graduate school. And in most states, you have to go, you can't just stop at the master's level. You have to go on for the doctorate. Psychologists, in most states, there's a few that still allow practice at the master's level, but most states require doctoral level training.
Wow. My good friend from college, she got her BS in psychology, and now she's working at her DO at the Philadelphia College of Osteopathic Medicine.
Great,
so
yeah.
We're really rooting for that. But that's awesome just to see the comparison. You've been here for about 7 months now, and you obviously have a wide range of experiences in the mental health field and behavioral health field altogether. Can you elaborate a little bit on that? Like, what was that like for you?
Sure.
Growing up through the psychology field as a up-and-comer to where you are now?
Yes, thank you for asking. It's my work history and experience has been quite diverse, which is part of what drives me, is the opportunity to sort of get into a certain segment of the behavioral health industry or field, master it, and then eventually I get kind of bored. So it's time to move on and do something new. So throughout my experiences, the bulk of my experience was in college mental health, college counseling center work, colleges and universities, multiple ones across the United States that I worked in as I was training through grad school and coming up through my predoctoral internship. Then, some things happened. I moved, and I decided I had learned everything I could learn in that part of the field, and I went in and became I did a fellowship in what's called health psychology, and I became sort of healthcare leadership in the long-term care field, or the subacute rehab segment of behavioral health. And so for many, many years, and that is the field where I met Dr. Dixon 10 years ago. She and I worked together.
Dr. Dixon being our current company president.
Yes, exactly. So I did that for many, many years. But while I was doing that healthcare leadership work, hiring, training, managing, leading the outputs of psychiatrists, psychologists, licensed clinical social workers, I also was able to do some executive coaching, business consulting work that a lot of psychologists who are IO based do. So I got to do some of that. I also did some dabbled in some private practice. So I've gotten to do a lot of different things.
Yes.
There was a time when I did some pediatric cancer work that happened during COVID, where I was able to really do some of that niche work, and in particular I wanted to get some nonprofit experience. So that met that need and helped me learn all I wanted to learn there in that part of the field. And then this opportunity came up, and this was a segment of the behavioral health world that I never really got to do a deep dive in. I'd always sort of touched on aspects of the populations that we treat here at Project Transition, PCS, but I never got to really, what I call, master the knowledge, skills, and abilities that a person needs to be able to do good work in this space. So that's part of why I'm here.
That's awesome. You had mentioned just briefly about your work with the Pediatric Cancer Foundation. I think that would have ruined me. I don't think I'd be able to mentally be able to do that. What was that like for you?
I'm so glad you asked, because not a lot of people ask about it. And the truth is that was a really tough job. At that foundation, I worked not just with the pediatric cancer patients, but we also provided unlimited lifetime services to their siblings, to their parents, and to their grandparents, those affected by pediatric cancer diagnoses. Interestingly, and not a lot of people think about this, pediatric cancer actually hits young adults. So our population goes up to around the age of 40. And so these would be adults essentially married, possibly having children of their own, who would be impacted by a pediatric cancer diagnosis. And so it wasn't just kiddos I was working with, it was also some young adults. And quite frankly, I did that job as long as I could, despite the continual losses. Quite frankly, I got tired of bearing my 14-year-old patients. And moving through that process of, all of the learning that goes on with that, and the preparation for if they don't make it, both for them as well as their families. So it was a wonderful job. I learned and grew so much through that process. But quite frankly, it was the most sad job I've ever had to do in light of the losses, the significant number of losses.
My friend did an internship at Fox Chase in college. If you've ever heard of Fox Chase, it's a cancer research center.
Okay.
And there were days when she'd just come home and like just bawl her eyes out. Like it was, I can't even imagine like doing what you did. It's very much like, thank you for doing that, because that's something that's definitely needed, but not everybody's willing to do. Yeah,
it was tough, but I'm glad I did it. Absolutely. I have no regrets.
Absolutely. And you said private practice, right? So you ran your own cognitive health evaluation practice in North Texas, as per an article I found online. Can you elaborate a little bit on that?
Yeah, so throughout my career, starting in grad school, psychologists are trained to do neuropsychological assessments, including anything from IQ testing to executive function assessment and examination, including also personality testing, as well as other areas of cognitive functioning. So including all aspects of mental health and whatnot, problem-solving skills, judgment, all of that. So I have been able to, throughout my career, utilize that skill set and stay engaged in that kind of work, because for me, it ties into not just who we are in our personal lives, but who we are as we show up at work. And how can we optimize outcomes both in our personal lives as well as in our work lives, or in our school performance, or in our decisions about whether or not, what should we know about how our brains work before we contemplate going on into grad school. So that knowing who you are and how your brain works, where its areas of strength are and where your personal weaknesses may lie, can really be empowering for not just individuals, but also for their families, their parents, their teachers, anybody in their support sphere that's helping them have the best life possible.
We often overlook the support aspect, that we have to also focus on them as well, because they're going through it too. So thank you for touching on that. So now we're going to take a little bit of a pivot towards mental health moving forward, just like your thoughts on it, if that's okay with you.
Sure.
In 2023, you contributed to an article about coping with childhood cancer, in which you stated many families immediately long for a return to life before the diagnosis, as they grapple with feelings of panic and a loss for normalcy. Could that same notion be shared with those who are just coming to terms and discovering that they have a mental health diagnosis?
Yeah, I think so. I think once it's all about a shocking diagnosis or a shocking reality, whether there has been indications sort of leading up to it or whether it's just really out of the blue. Anytime a human is finally at a place where they can see, hear, and sort of acknowledge that there is something really unknown, really scary, potentially really big, that could be pretty self-defining for some people, it is a moment of, for many, it feels like a catastrophe. And part of the intervention is to help individuals, whether it's a healthcare kind of related diagnosis that could be very chronic or life-threatening, or a mental health sort of diagnosis, in those moments, assisting individuals in finding some sense of, I can do this. I don't know how I'm going to do it, but I can do it. There will be help, there'll be support, there'll be resources, and that I'm probably stronger than I realize because I've never had to move through something like this awareness before. So there are similarities, of course, and of course with a behavioral health diagnosis or realization that, we as individuals have certain ways that our brains, sort of work and think, certain biological makeups that maybe make us more prone to suffering from, let's say, depression or anxiety. And we also live through events and environmental things that go on in our lives that can also contribute to those kinds of experiences and diagnoses, if you will. It's an opportunity to sort of have a moment of, okay, this is part of what I cannot change at this point. This is happening. This cancer is here, or this diagnosis of a mental health condition is here. What am I going to do about it? And while there are many things we cannot control, there are also, as we know here in behavioral health, lots of things that we can. So it's a real privilege to be able to be in those spaces with people who, in those moments, feels very scary, very vulnerable, and also a whole lot of unknown about what is this going to look like for me.
This really comes to terms with me, actually. So when I was in college, towards the end of grad school, I hadn't left my room in my apartment in a week. My specific bedroom I left a week, and then I was getting a lot of intervention from my roommate to hey, let's go do stuff and all that. But I was just feeling really, really down, and something was wrong, right? And I didn't know what was wrong. I've been feeling, I felt like that through a couple times throughout my life, but at this point, it was as worse as ever been. And then I got a call from my dad, and he was like, "Listen, after you were born, I did a 7-day stay at a hospital because my mental health wasn't all right as well. I had to support you, a newborn baby, as well as your mother, and it was just hard for me. And then I realized, wow, my mental health issues run in my family.
Yeah.
And he was able to come out on top, and he does everything right that he has to be. Yeah. And that just showed me wow, if he was able to do it, and he's gone through so much in his life, and I can do it too.
Absolutely.
And that's when I came to terms I have an issue, but it's not gonna dampen me. It's not gonna make me any less of a person.
Correct. It can be overcome. You will move through this, and as your dad demonstrated in his own life, it's not your whole world is not just this.
Yeah.
There's something beyond this.
And now it's easier for me to identify when I'm having those slumps, or when my mental health is becoming too much to bear, and I need to step back for a while.
Yeah. That's amazing. What a great story. And what was it like for you to hear Dad disclose that to you?
Well, I've never heard him get that vulnerable before. My dad's a very strong man. He's gone through a lot in his life. Yeah. So to hear that, it really made me feel wow, dad's a human, right? And he gets it, and so I will always have that with my father, and I love him so much for that. And I'm just I'm a Martinez, so it's part of being a Martinez to overcome your tribulations.
Yeah, and it's part of the human experience, right? No life is perfect or free of pain and suffering. And while all of our pain and suffering is a little different, I think that's incredible, and it helps you to know that this moment that those slums when it happened in the past and when it happens now and also in the future, like that is not who you are. It's something that you manage and work through. Absolutely. But you're way more than just that.
That's why I always say he's my biggest superhero for sure.
That's awesome. Yeah, great story.
Thank you. I don't ever really tell that story very often, but I think it's important for people to know, like, hey, we are human. These things do happen to everybody. I'm more than just a voice on this podcast, I promise you. There's some depth to me. So mental health changes, right? As just like procedures in medicine change or trends in marketing change. How do you, as a psychologist, stay up to date and in the know with the most modern practices?
Yeah, great question. It's so important, right? Because I've been out of graduate school now for a little over 20 years. And if I had just decided I knew everything I needed to know back in the day, I would not be effective or be a responsible human delivering care myself or helping others deliver highest quality care. So keeping up with the literature, understanding what's going on in terms of not just the science and all of the outcome literature that's coming out, that we know what works, what is still accounts for the successes in treatment. There's definitely a responsibility for all of us to do that. Psychologists, like many professionals, are required to get continuing education.
Those CE credits.
Those CEs, you got it. And I'm currently licensed in 3 different states, and they're all 3 on different timelines and require different types of CEs.
Wow.
So that's a big part to manage. It's a big job to manage all of that. But for me, it has helped me stay relevant. It has helped me stay on top of what is happening, because those CEs are, they're not just, go read a book. A big portion of them have to be live. They have to include back and forth conversation and dialogue and the ability for the participants to ask questions. So that keeps me up to date in terms of what's out there. I have had the great opportunity over the years since formal training, to be certified in a variety of different treatment procedures, also assessment tools, for example. And those are, some of them are new. They didn't even exist when I was in school. And so it's been fun to kind of follow that, what we call empirically evidence-based or empirically supported treatment movement that has happened as we've gotten more sophisticated technology. Computers and imaging and all the things that have been continuing to improve over the years. It's actually given us more actual hard science and evidence of what it is we know, what it is we don't still know, and how do we best intervene and treat different conditions or measure certain aspects about human functioning.
Wow, that's a lot. That really is a lot, and you're doing everything you can to stay up to date, which is like, I can't even imagine having that. Being a doctor yourself, like, I can't even imagine doing that. For me, for marketing side, I graduated 3 years ago, which is crazy to think about, and things changed just like that within that first 2 years. And Ellen, who's our VP right now, but she's always encouraging me to stay up to date with all the marketing things to go on, and she's to do these extra classes and certifications. So if it's hard for me, I know it's even harder for you guys, for sure.
But that's part of the fun of it. It's a lot of work, but it's we have to be, I think humans by default have to be sort of lifelong learners, because the universe will leave us in the dust if we're not.
Absolutely. You have about 2 years of solid sustainability before things change again.
Yeah.
So just to circle back really quick to something that you touched on earlier, you consider yourself a business-oriented psychologist. What exactly does that mean?
Yeah, great question. So for me, what that means is I was lucky in my graduate program. I got a lot of not just the clinical elements of what I needed to learn to know to become a licensed psychologist, but I was in a university program at the University of Akron, Ohio, that had a really top-notch IO psychology, which is business psychology, doctoral degree as well. And so for the first couple of years, the clinical students and the IO business psychology students, we were all kind of together in our core classes. And so a lot of the professors who taught me statistics and who taught me some of those core subjects were actually IO psychologists, non-clinical. My dissertation straddled clinical and IO. So my actual big dissertation project was some would argue was in the IO realm, but it was also in the clinical realm. I straddled both of those. So I've always, from a very early stage, had an interest in what was happening in the world of IO psychology. Like I said before, I have done some business consulting and executive coaching, a lot of career counseling, career assessment, and again, just that intersection between who we are as humans in our everyday life and who we are on the job, and how we move through that world of work. Because unless you win the lottery or you're independently wealthy from inheritance, we all have to work. And we actually are at work more than we do anything else as humans. So that is such an important part of our identities, right? So for me, being a business psychologist is I've been lucky to be employed in jobs since getting out of grad school that weren't just clinically based. I was able to help lead and manage and be a leader, if you will, in those behavioral health organizations. So I got to kind of scratch that clinical itch by doing a little of it and also supporting huge clinical teams who were doing the clinical work, but also at the table of decisions that are more IO or business psychology based.
And that's why you were able to jump in feet first when you started here, like right off the bat. That's awesome.
I hope so.
Yeah, no, no.
There's still a huge learning curve right wherever you go, but the principles of business psychology are pretty common across wherever. If I'm talking to a gas and oil company in Texas, or if I'm talking to a behavioral health company here in PA.
That's awesome. So I have one more question for you, if that's cool with you.
Yes.
So this is more of like a personal question, right? So if you had one message for anyone that's currently struggling to deal with their mental health or is coming to terms with their mental health right now, what would it be?
Great question. And gosh, I just don't have anything that just rattles immediately off the tongue as a sort of canned response that I would go to. But shooting from the hip, I would say lean in on your resources, supports, and your community. Even though some of us may be introverts and be just fine and satisfied with a lot of alone time, as humans, we are social creatures by nature. So while our various need for social engagement and social interaction does vary, the truth is none of us can get through successfully this thing called human life without having the ability to build community to some extent with others out there in the world, have resources, suggestions, ideas, input from other people. So I would say lean in on that and find who your tribe, where your tribe is, who your tribe is, where they are, and how to access that.
It's like the Beatles say, I get by with a little help from my friends.
I love that song.
Yeah, so do I. I'll plug this song at the end. So Dr. Gersch, thank you so much for coming on the podcast. Really, really appreciate it. You have been absolutely amazing. We'd welcome to have you on any other time you'd want to be on. Anything you want to discuss, we'll be more than happy to have you.
Thank you so much for the opportunity, Brandon, and you are good at what you do. So thanks for being part of PT.
Thank you, ma'am. Thank you, guys. Talk to you all next time.